Dr. Katz had previously let me know he would be stepping out a little bit early. Okay, continuing. I have 5 more questions that each of you can answer one of them. The first one is, how do we protect our thyroid gland against thyroid issues? Number 2, what do you recommend for people with acid reflux? Number 3, what do you recommend for people who have eczema? Number 4, do you recommend mammograms? And if not, do you recommend thermographies? And number 5, what type of treatment would you advise for someone diagnosed with cancer? So the 5 questions again, well, the first one was about your thyroid, second about acid reflux, third about eczema, fourth about whether you should get mammograms on a regular basis or at all, or thermography, and the fifth one is what type of treatment would you advise for someone diagnosed with cancer?
I'm going to leave with Dr. Katz with those 5 questions.
I'll talk about reflux since I'm actually a reflux surgeon, so I do a lot of reflux. The reflux is a complicated disease. It is amazing how many people have it, almost everybody. A lot of it has to do with physiology, with weight, with our diets. There's been some very good studies showing plant-based diet helps. The reason plant-based diet helps is because it's low in saturated fat. There's a muscle at the end of the esophagus called the lower esophageal sphincter. It is loosened by several things. It is loosened up by saturated fat, caffeine, alcohol. So that's why after dinner, a lot of people get really sick and get heartburn. Workup and treatment of this is very complex. We start with lifestyle changes like I do with everybody, plant-based diet, again, not vegan or vegetarian necessarily, but a whole food plant-based diet, low saturated fat, low caffeine, low alcohol, keep the bed elevated. I do use the medications. There's been a lot of debate lately over whether PPIs, which are Nexium, Prilosec, omeprazole, there's been some debates over whether they may contribute to all kinds of things, such as dementia, osteoporosis, things like that. The data is very circumspect that they do that, though who wants to be on a pill all of your life? Certainly lifestyle changes and getting your weight under control helps. There are certain people where reflux is so bad that just about everything causes them to get severe heartburn. If they bend over, food comes up in their mouth. That's a different story. We do tests for that. I will do a scope where I put a camera down their mouth. Do they have irritation? Do they have changes in the esophageal mucosa that suggest that this acid reflux is really bad? Because that can lead to cancer. In fact, there's been a huge increase over the last 20 years in esophageal cancers of the reflux type, instead of the old type, which is squamous cell. And a lot of those have to do with this changes in the esophagus called Barrett's changes. So if people have that, then we start getting more aggressive. That's when we start talking about surgeries to combat reflux. So I have kind of a whole protocol. It starts with lifestyle changes, medicines if needed. If you get really severe problems, we do endoscopy. We put a little, very smart little device inside the esophagus that measures how much acid is coming up, so I could get a quantitative score. If it's very high, then we may suggest surgery to fix that. Yes, Dr. Mills was mentioning H. pylori. H. pylori is a bacteria that causes not necessarily reflux, but it causes gastritis, like an irritation in the stomach. And we've had a huge increase in H. pylori that has been both documented in the literature, but I have been seeing it like crazy in my patients. And that will give you symptoms of reflux, but it's not true reflux. It's just irritation of the stomach. And we do treat that with an antibiotic regimen that is now becoming resistant. So it's a little bit scary with the changes for H. pylori. It used to be that we had very good control of it with antibiotics, but now it's down to 70%. Yeah.
One comment about the H. pylori. The humans have lived with H. pylori for hundreds of thousands of years, and eradicating it, I think, is not necessarily the best thing, because now we know that when you're sterile from H. pylori, it increases your risk of inflammatory bowel disease and reflux, ironically, because that's sometimes the reason why people are treated.
Yeah, that's why I don't actually do biopsies unless I see a problem, because we have found H. pylori, but there's no gastritis. So what do you do with that? And some people are inclined. So I don't do a biopsy unless I actually see inflamed stomach, and then I'll treat it only if there's inflammation.
Right. I'll take mammography. Here's the problem with mammography. It does not reduce the risk of dying of breast cancer. bottom line. And the only reason to have a screening test is either that it's going to prevent a morbidity of some sort or it's going to prevent early death. So what you do get when you have mammograms, routine mammograms, and I'm talking about screening purposes here, is you find a lot of things that you really would be better off not knowing about, like ductal carcinoma in situ, which is not cancer. It's a risk factor for cancer. By itself, it doesn't mean very much, but it gets treated like cancer. Lumpectomies, increasingly a number of women getting mastectomies, often radiation treatment and hormonal therapy. I mean, it's astounding how much overtreatment there is. The worst part about it is that these women then become survivors who would have been survivors 5 years. They would have lived 5 years anyway. And it makes the cancer industry look like it's doing a whole lot better because you take a bunch of people who don't have cancer, you treat them as if they have cancer, and the numbers get better, and they're all out racing for the cure and the whole 9 yards. It's just a despicable distortion of what should be going on. Thermography is no better. In fact, if anything, it suffers from more inclination to find even smaller abnormalities that are meaningless. And there's such inconsistency in the way that the thermograms are read. No two people come up with the same answer. The longer they look at various images, the worse that they get. So the studies are pretty abysmal. One just real short story I'll share with you. I was driving to work one morning, and I turned on the radio. I don't know what station, but somebody was talking on a talk show talking about the race for the cure in Central Park. And she was a famous person. I don't know who she was, but she was in charge of it. She was like the figurehead person. And the person interviewing her said, "Tell me your cancer story." And she said, "Well, I had a mammogram last February, and it was clear. And then in September, I found a lump, and it turned out to be stage 3 cancer. So fortunately, this happens all the time. So it's an interval cancer. These are the ones that grow in between mammograms. So fortunately, thanks to modern medicine, I had treatment and chemotherapy, and now I'm fine." Well, it's a year later. I don't think we know she's fine yet. But in any case, at the end of the interview, after all about the race in the park this Sunday, the interviewer says, "What advice do you have for women?" And I just almost drove my car off the road. She said, "Well, you know how we are. We always want to take care of everybody but ourselves. And so take the time and go get that mammogram. It'll save your life." And I thought, listen, lady, you just told everybody about how you found the cancer a few months after the mammogram told you were clear, and it doesn't save your life. So here, one last thing I want to say about this. One of the most insidious things about all this screening that we do, with the exception of cervical cancer screening, which really does work, is people drink the medical Kool-Aid and think that they're protected. All right, so basically what happens is they get their mammogram results back and it's clear, and they think, you know what, somewhat in the back of the mind, eating cheese pizza and having wine for dinner every night's working out pretty well for me, along with sitting on the couch. I'll do it for another year, and then I'll go get tested, and I'll see if I'm still getting away with it. And we've got to stop doing that. A clear mammogram is not, first of all, it doesn't mean anything, but the second thing is this type of incessant screening is giving people a very false sense of security about their health, and it's a very disingenuous, destructive thing that we're doing.
I will say this, because in a prior entity, I used to be a breast surgeon, and I quit because I could not stand the mammogram. But it wasn't any kind of insidious. I was cutting breasts out medical legally. Like, as soon as you get that mammogram and it says you've got this, you have to cut it out because otherwise you will be sued. The lawsuits in breast surgery, and I could not stand all the, it turned out we were looking back at our data and we found I think it was like 6% actual breast cancer of all the biopsies and breast tissue that I was taking out. And so it's a tough world. I don't know the right answer. I mean, MRIs are extremely sensitive. So they will pick up the cancer, but they will also pick up 100 other things that aren't cancer.
Right.
And I found myself whittling away at women's breasts until I was like, gosh, you should just get a mastectomy. Also, I didn't get sued, so I quit that.
Thank you.
So I'd like to talk a little bit about the cancer question. First of all, I think it's important to understand, we talk about cancer as though it's one thing. And cancer is not one thing. Cancers arrive in different tissues, and cancers of different tissues have different characteristics. So you have blood cancers, like leukemias, which are very different from solid masses. And even within the category of solid tumors, a solid tumor in your lungs carries a very different prognosis from a solid tumor in the testes or the prostate, and so on. So the number one thing we have to understand is that, cancer is not just one disease, and you can't just assume that one approach is going to fit every type of cancer. Now, that being said, the question was, well, how do you treat cancer? What would you recommend? All right. In the interest of transparency, I am a critical care doctor, not an oncologist. So one of the first things I would do is look for an oncologist I respected to refer the person to. But what the question I think is getting at is, what do I think is the best approach to it? And I want to share some stories from some people that I've met to kind of illustrate what I think. 2 years ago, I was invited to Ireland to speak at the Reg Fest. Afterwards, I met this young man. He's Greek. He told me that he had been in the Greek army, training for the Olympics. He was lifting weights. He was a 400-meter runner, and he thought he had to eat, mainly red meat, which is what he was doing until he started noticing abdominal pain, blood in the stool, got worked up, and he had stage 3 colon cancer, a large mass with evidence of metastasis. And I was expecting him to say, I then had surgery and changed my diet. That's not what he said. What he said was, in essence, I eventually became completely raw vegan. I did not do surgery. I did not do chemo. I did not do radiation. And over a 6 to 8 month period, the tumor regressed and all the cancer markers went to 0. And at that point, he was 7 years out. He effectively cured himself with diet change. Last February, I met a woman down in Alabama who in 1996 was diagnosed with stage 3 breast cancer. Stage 3 breast cancer, according to conventional medical dogma, is a death sentence. Women are told, we can treat you, we'll give you a lumpectomy or a mastectomy, followed by radiation and chemo, which will buy you some time, but eventually the cancer is going to come back and it's going to kill you. She had a pecan-sized lump that was removed, and 11 of 17 lymph nodes were positive for the cancer. She had stage 3 breast cancer. She decided that after her lumpectomy, she was going to go completely vegan. She went raw vegan for about at least 6 months, and over that time, her tumor markers went to 0, and as I said, this was 1996. This woman is down there teaching plant-based classes in Alabama. I just met another woman who was diagnosed with stage 3 colon cancer 3 years ago. She actually went to the Hippocrates Institute. I think she had the initial mass removed, but then she became completely vegan. Again, she was raw for about 8 months before she started weaning cooked foods back in, and she's 3 years out and by all appearances cancer-free. Met another gentleman who in 2013 was diagnosed with stage 4 liver cancer, told, dude, you got 6 months, get your life together because you're not going to be here. He went to see a vegan practitioner in Washington, D.C., and he put him on a vegan diet, again, raw for a minimum of 6 months. And Frank is here, still alive, cancer-free, I guess 7 years out now. So what I'm saying is that there clearly is great power within plant foods to help treat cancer. Now, can I tell any given individual that this is going to cure your cancer? No, but what the data do show, and this is just general medical data, that those who change their diet post-diagnosis, given all cancers, to a diet that includes more or mostly plant foods and fruits and vegetables, that it will increase their overall survival. It also increases time to recur, or their cancer-free survival. So we know, even within the conventional medical literature, that plant foods are having an effect. And there are these admittedly anecdotal cases that I just mentioned of people who actually, by all appearances, were able to cure themselves of cancer by using a plant-based diet. My point is this: plant foods have power. They have potent anti-cancer properties. This we know. I'm sorry, I got my chin down. This we know from, again, a number of different studies. We need more research. We need to figure out what the hell is happening in these people who do have these cures. And what is it about particularly a raw plant food diet that seems to have such bioactivity against cancer cells? And if anybody came to me with cancer, I would talk to them about the various options, conventional modalities, whether, like if I had been in Emmanuel's, that's the Greek gentleman's shoes, I would have said, cut out what you can cut out and then I'm going to be going raw. But he was bold enough to just do it with diet alone. Obviously, it's each individual's decision, but whatever they did, I would strongly urge them to be on a strictly plant-based diet, because we know that animal protein and animal food feeds cancer. And the analogy I use is, if your house catches fire, it makes no sense to have the fire department in the front yard pouring water on it while you're in the backyard throwing kerosene into the house. It's just going to eventually burn down. And so when you get a cancer, you've got to stop doing the things that are feeding those cancer cells, causing the inflammation that's driving the cancer, and that's an animal food-centered diet.
But I would say this, because of course I say that, but as a cancer surgeon and having done, man, please go and see an oncologist and don't say that. You know, if an oncologist was here, they would go crazy with the anecdote on the colon. I've seen colon people come in and, oh my God, had they just gotten the colon surgery done earlier, they would have lived a long, healthy life.
As I said, I would have done the surgery, and I'm not recommending this.
Don't
I'm
take
just,
it as,
I'm saying that what it shows is that plant foods have power against cancer, but that I would never, and I said, the first thing I would do is recommend someone
I just
to
want to make sure the
an
audience gets
oncologist
that
I respected.
because,
But you know, it has to be the individual's decision.
I mean, if you look at Ornish's study with prostate cancer, he took the blood of the vegans and dripped it on
The
agar
cancer
gels
cells,
with
and it
cancer
killed
cells,
it.
and it killed them. So there's definitely an advantage to vegan diet, but there's certain diseases. If I got pancreatic cancer, I'll try anything.
Right.
Give me what you got. I used to do a surgery where we cut out the pancreas. I wouldn't get that done. But there are certain surgeries, colon cancer and breast cancer, that are very treatable now. The rates of cancer death from breast cancer and colon cancer are going down dramatically with some of our treatments. If I had glioblastoma, I would have to say, what should I do?
Right.
But there are situations where I definitely would still go and see an oncologist.
I also know of a vegan woman who had stage 4 ovarian cancer, which is essentially uniformly fatal. She had the debulking surgeries, she had the intraperitoneal chemotherapy, she did all of that, plus she went raw vegan, and she is like at least 12 years out, which is, again, anecdotal, but unheard of. So my fundamental point is just to say plant foods have power, and that whatever modality of treatment you use, you got to make sure that being 100% plant-based is part of it.
Great.